The Emerging Enterprise Awards are brought to you by OCBC, Asia's best SME bank, and the Business Times.
A profound demographic shift is taking place in Asia right now. By 2050, at least 11 countries will be classified as super-aged nations by standards set out by the United Nations, with over a fifth of residents comprising people aged 65 years and above. With Singapore set to reach super age status as early as 2026, the nation's vision centers around aging in place, a concept where seniors can age independently in their communities, supported by digital technologies like telemedicine and smart home devices, as opposed to healthcare institutions such as nursing homes. This brings into focus the importance of integrating medical, social, and allied health services within the heartlands, something that PanCare Medical has built into its model, which adopts a more holistic approach, addressing not just medical but also functional, mental health, and nutritional needs. And for more insights, we're joined by Dr. Ong Guan Hong, CEO of PanCare Medical and winner of the 2024 Emerging Enterprise Award. Dr. Ong, welcome to Money FM.
Hi, good morning, Audrey.
It's great to have you join us, Dr. Ong. So first off, congratulations on the win. Could you maybe tell our listeners, what does winning the Emerging Enterprise Award mean to you and your team at PanCare Medical?
Thank you very much for inviting me here. The award actually allows us to take an introspective view of our processes and our progress so far. 7 years has passed since we established PanCare Medical. We have reflected on what makes us successful, and also we have started to see how do we plan for the future. With this award, how do we ensure that our business is sustainable, our business is relevant, and how do we help our society, especially the aging society, with all the medical and nursing needs that they need.
Okay, yeah, we're hearing a lot about holistic healthcare nowadays, and that's also what PanCare Medical is focused on, particularly for elderly patients. So PanCare Medical is focused on holistic healthcare. So can you explain what holistic healthcare means in the context of your clinics, and why is this approach so important here in Singapore?
Holistic healthcare is actually a very important approach to how we should approach medicine for our patients. In a primary care setting, healthcare is not just only about the doctor and patient's relationship or the medications that the patient is taking. There are many factors that influence the health and the well-being of patients. Psychosocial factors, like family support, whether they have adequate social activities, whether they are eating healthily, whether they have a good lifestyle, a healthy exercising routine is very important as well. Mental well-being, is also very important. As our society ages, there are other psychiatric issues or mental well-being issues that will arise in the elderly population. Depression, anxiety, cognitive decline like dementia, are all very real problems that we need to have safeguards and look out for in the primary care setting. Within the primary care setting, a very important aspect is financial planning for patients. It's very important for us as a primary care practitioner to be able to help them on this journey so that we reassure them to know that healthcare is affordable, to point them to the right care services so that it is not expensive for them, and also to let them know what subsidies or what kind of payment schemes they can use. And that will make them more receptive to approaching us for treatment and continuing with the care that they need.
Okay, so we understand, Dr. Ong, that you're working with community partners to expand home visit and telemedicine services for these isolated, frail, mobility challenged seniors. And you talked about, the complex healthcare needs that they need. So how challenging is it on that front?
At the primary care level, GPs have always been managing complex patients. But now we have increasing amount of elderly who are frail and finding hard to get out of the house, or it's difficult. They need to arrange for transport just to go to the polyclinic or to go to the hospital. Their loved one needs to take time off to accompany them. These are challenges that we hope with home visits, telemedicine, we can help solve part of the problem. One big challenge would be it's very time consuming to allocate resources or to spend time traveling from one patient to another. During the COVID period, we actually identified, from the grassroots, they gave us feedback and on where these seniors are. And we sent teams down to visit them. Either they are infected with COVID and then we manage to monitor their health, or they need an updated COVID vaccination and we send teams down to vaccinate them. These seniors, their problems still continues after COVID has ended. So now we have to focus on how do we deliver healthcare to them in a way that is very convenient for them and is cost effective for all parties involved.
Yeah, and Dr. Ong, you talked about the home visits and telemedicine, but some of the other services that PanCare Medical is bringing into the heartlands include physiotherapy, dietitian services, counseling, and specialized wound care. So how do these services work alongside the basic healthcare needs of seniors?
As we want our seniors to age in place, these services that you have mentioned, they are traditionally found in the hospitals. But it used to be found in hospital because there's a critical mass. People will go to them and use these services. As we age, this critical mass actually appears in our heartland, in our neighborhood. So I hope to bring these services, establish these services in my GP clinics, so that we can either provide them in clinic, or we can send them, send our dietitians, send our wound nurses to the house of patients who need them. And we have been training our nurses. We have a pool of nurses who help us in our projects. We have brought some of them over to our clinics. They have undergone wound training. We work with vendors who provide wound care products. We have worked with companies who provide food for swallowing, patients with swallowing impairment. They have dietitians, they have speech therapists. We are working with various partners. We are building our own capabilities so that we can bring these services to the community.
And you've been doing this for a long time, Dr. Ong. So based on your experience, what are some gaps or areas you think should be improved on in the coming years when it comes to healthcare for seniors within the community?
One of the challenges, one of the gaps I feel that is that these services need time to set up. You need to find people, you need to train the right people, and you need to make people aware that you have these services. Then they can utilize it. So these are, we are trying to create awareness. We are giving educational talks. We are partnering with Silver Generation Office. We are partnering with Active Aging Centers to find out the needs of the elderly in our community and how can we better support them. Another issue I feel, or a problem that may arise, will be social isolation for our seniors. So as our working class, they're bogged down by work, their family, their children. They have less time for their parents, and also some seniors, they are not aware of the resources out there that they can engage in to have meaningful life activities, like active aging centers activities, dementia care, exercise classes in the community. So one natural touch point is a clinic where they are sick, they come to us. That's where we can introduce to them that actually, you need all these services to lead a healthy life. It's not just about controlling your blood pressure or controlling your cholesterol level.
Yeah. All right. So, Dr. Ong, we covered a lot of ground today. But before you go, how is PanCare Medical set to support in those areas that you just talked about? And are there perhaps learning points from abroad that your institution has studied to see how positive points can be adapted in Singapore's context?
Besides setting up our own services, we have many partners in the community and in the academic area that we can tap on and see how we can complement their services and how can we use their services as well. So we are working with NUS Pharmacy Department, for example. Their students are on the project where I'm an advisor. We promote healthy eating, food pharmacy. So overseas, they have projects that have shown effects, in reducing hospitalization, controlling blood pressure or diabetes. So we are trying to use these recipes and modifying it for local taste buds. We are going on an educational tour, to active aging centers to teach them how to cook, what choices of food should be made. And we are looking at how do we commercialize it, to make it mass market, to make it affordable for just any residents and just at a normal kopitiam store. Yes, and we are also partnering with many charitable organizations, not-for-profit organizations who have nursing care and for capabilities. Then we bring in our medical expertise and bring in other services that they are short of or they need help with. There's already quite a lot of community service providers. So how do we ensure that we optimize everyone's services to cover our own each area that we have clinics in?
All right. Well, a great overview on PanCare Medical's efforts in providing holistic healthcare for seniors in the heartlands. Dr. Ong, thanks so much for sharing your insights and for your time this morning.
Thank you so much.
Thank you. We've been speaking with Dr. Ong Guan Hong, CEO of PanCare Medical and winner of the 2024 Emerging Enterprise Award. Stay with us on Money FM 89.3.